Hi viewers, in this video we are going to discuss about Amma Maternity Kit. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing. Objective of this video. At the end of the video, the viewers are able to enlist the objectives of Amma Maternity Kit, explain about overall target beneficiaries, enumerate the component of Amma Maternity Kit, list down the various roles of Anganwadi worker in providing Amma Maternity Kit. Introduction. The Amma Nutrition Kit scheme is a maternal welfare initiative scheme. Okay, it comes under mainly for delivering the maternal and child health services. Under that only Amma Nutrition Kit scheme is coming. It's implemented by Government of Tamil Nadu. Aims to improve the maternal nutrition and the birth outcome. We know very well that antenatal diet plays an important role in delivering the healthy baby and the healthy outcome of the mother from the delivery. So in this scheme, we are aims to improve the maternal nutrition and birth outcome. Overall target. So the targets are pregnant and lactating women in the state. Okay. Amma Nutrition Kit scheme is a maternal welfare initiative scheme and it was implemented by Tamil Nadu government. It aims to improve the maternal nutrition and the birth outcome. The target groups are pregnant and lactating women in the state. The background of the scheme. Maternal malnutrition contribute to low birth weight, anemia, and increase in maternal mortality rate. So we know that Tamil Nadu has a strong MCH indicator, but still addresses the nutritional gaps in the antenatal period, and we are seeing due to that so many disorders, okay, among the children as well as the postnatal mothers. So the scheme complement the national maternal health program. Okay, this also add values to our national maternal health program. Launch and governance. It was launched by Government of Tamil Nadu, and the Amma Maternity Kit, the scheme named after the former Chief Minister J. Jayalalitha, popularly our people used it to call as Amma. So the scheme implemented through the Department of Public Health, Primary Healthcare Centers and Anganwadi Centers. Okay. Objectives of the scheme. Improve the maternal nutritional status. The ultimate aim of the scheme is improve the maternal nutritional status. Reduce anemia among the pregnant women. Prevent low birth weight babies. Promote safe pregnancy and health delivery. Improve infant health outcome. These are all the objectives of the scheme. Target beneficiaries. Pregnant women registered in government health facilities. They are all eligible to get the benefits, particularly women from low income families, rural and underserved populations. They are concentrating more. Beneficiaries enrolled through the PHCs and the Anganwadi centers. Component of the Amma nutritional kit. The kit typically includes iron and folic acid tablet, protein-rich health mix, dates, nutrition powder, personal hygiene items. Nutritional significance of the kit item. Iron tablet, mainly to concentrate for preventing anemia. Protein mix, support for the fetal growth. Dates, natural iron and act as energy source. Health mix powder, it balances the macro and the micronutrient for the antenatal mother. Hygiene product, it reduces the infections risk. Okay, so iron tablet, protein mix, date, health mix powder, hygiene product, this and all, they are providing in the Amma Nutritional Kit. Now they are all distributing this kit to the antenatal mothers. This is distributed in phases during pregnancy and given during antenatal visit, recorded in the maternal health register, linked with the routine antenatal care services. It linked with the routine antenatal care. It encouraged the regular antenatal checkup and promote yearly registration of the pregnancy so that the people are able to get the benefit in a proper way, and ensures monitoring of weight gain, hemoglobin level, blood pressure level. Public health importance of the scheme: it addresses the malnutrition at community level and reduces the maternal morbidity, contribute to the reduction of maternal mortality ratio, infant mortality ratio, and supports sustainable developmental goal. Monitoring and supervision. How the government of Tamil Nadu is monitoring whether the scheme is going in a proper way or not. First one, tracking through the PHC records, okay, and second one, supervised by the district health officers. Regular reporting to the state health authorities, okay, how many people are registered, how many people got the services, how many people are received the kit, like that. Evaluation based on the birth outcome and the anemia prevalence, okay, whether if the people got the nutritional kit and taken those tablet or health mix in regularly, means we able to see the outcome, okay, what is the outcome of if the people received the services in a proper way. Surely there will be a healthy baby and the healthy mother, okay. That act as a, by that we able to evaluate whether the scheme is reached to the public in a proper way or not. Advantages of the scheme: it improves the maternal dietary intake, enhances the awareness of nutrition, strengthens the maternal health care utilization, it reduces the financial burden on poor families. Role of Anganwadi workers. The first one is identify and register the pregnant women. Okay. And second one is provide nutritional counseling to the mother. Third one is ensure the kit distribution. Next, conduct the home visit for the follow-up. Providing nutritional counseling is very much important because the people should aware why the government is providing this are all the items and what are all the importance and benefit if the mother is taking those items in a regular manner. Then only they are able to consume the food items in proper way and able to get the benefits. Comparison with the other schemes, Amma Nutrition Kit, it's mainly a nutritional supplementation program. It's concentrating on registering the pregnant women and providing nutritional kit, thereby supporting to normal MCH program. Okay, and next up, Pradhan Mantri Matru Vandana Yojana. This is cash incentive for pregnancy. Third one is Janani Suraksha Yojana. This is also incentive for institutional delivery. Mainly they are providing money to encourage the mother conducting the delivery in a proper institution or hospital. This is the basic difference. Amma Nutritional Kit, nutritional supplementation, concentrating on nutritional supplementation. Pradhan Mantri Matru Vandana Yojana, cash incentive for pregnancy. Janani Suraksha Yojana, incentive for institutional delivery. Challenges in the scheme: supply chain delay, monitoring coverage gap. Okay, we should monitor in a proper way, and compliance in consuming the supplement, awareness in remote areas. The people are not aware about this program, and these are all the challenges we are facing in delivering the malnutrition kit program. impact of the scheme. It improved the hemoglobin level among the pregnant women, better birth weight reported, and increased the antenatal mother registrations, enhanced maternal awareness. These are all impact of the Amma Nutrition Kit. Community participation in the what are all the ways the community able to participate? The first one, family involvement in maternal nutrition. Health education section, they're providing health education sections, the community able to get information related to Amma Nutrition Kit. Village health and nutritional days. By celebrating nutritional days, health days, we can able to create awareness among the public. Support from local self-government bodies so that everybody able to follow, because the leader is following something, automatically the people following the leader, they will be admiring in doing those activities. Conclusion. Amma Nutrition Kit is a state-level maternal nutrition initiative program. It focuses on preventing anemia and low birth weight. It strengthens the maternal and child health services, contribute to overall improvement of public health indicators of Tamil Nadu. Till now, we have discussed about what is Amma Nutritional Kit and what are all the items are there they are providing in Amma Nutritional Kit, importance of that thing, what are the challenges our government is facing, role of Anganwadi worker in providing those services, and basic comparison between Amma Nutrition scheme and other schemes. All those things we have discussed in this video. Hope now you have got some idea about what are Amma Nutritional Kit. Thank you viewers for your support.